I'm David Rutlen. I'm a cardiologist. I'm the director of the Division of Cardiovascular Medicine at UAMS. There's been a lot in the news recently about cardiomyopathies. Now, in general, a cardiomyopathy refers to the fact that the heart function is poor. The heart ejects blood, of course, with each beat, and a normal heart should eject at least 50% or more of the blood with each beat. If it's less than 50%, then we say that there's a decrease in the heart's beating ability and its ability to eject blood. And that might be what we call, it might be a cardiomyopathy. If it's severe enough, then by definition we say that that patient has a cardiomyopathy. Now, there are all sorts of conditions that can cause a cardiomyopathy. In the United States, the most common cause of a cardiomyopathy is what we call an ischemic cardiomyopathy. Ischemia simply means poor blood flow. And patients that have had heart attacks, or they have a situation where there's a chronic state of low blood flow to the heart, these are individuals that may have ischemic cardiomyopathies. It's also called the cardiomyopathy associated with coronary artery disease. And that's the most common one in the United States, as it is in many countries. And that's associated with the development of heart failure. It can be associated with the development of sudden death because of irregular heart action. Now, there's other types of cardiomyopathies also. There's a cardiomyopathy that's associated with excessive amounts of alcohol. If someone has long-standing high blood pressure, that can cause a cardiomyopathy and cause the heart's beating ability to decline. People can have a hypertrophic obstructive cardiomyopathy. This is one that is sometimes missed and sometimes is seen in athletes and sometimes leads to sudden death when the patients are engaged in physical activity. For all of these cardiomyopathies, they can be picked up. The patients may have symptoms. If they have heart failure, they have shortness of breath. If they have rhythm disturbances, they may be passing out. And working with their physician, the physician can become suspicious that the patient may have a cardiomyopathy. There may be some clues with an electrocardiogram. And then ultimately we can do a cardiac ultrasound, which is an entirely non-invasive study, no radiation, and we can pretty precisely assess whether or not there is any structural heart disease present. And for anyone that's going to engage in high school or collegiate or professional activities, they really have to be checked out by their physician. And there are pretty precise guidelines as to what to do for that evaluation, and if something turns up, what to allow the potential athlete to do or not do.